slot just before lunch. We have about 20-25 minutes. So it'd be great to hear some of your reactions to the presentations this morning, the discussions, and also just throw in your own experiences. Very keen to make this interactive. But maybe I'll just start with a couple of things. I think going back to Claude's presentation. Yeah, no, just you made that very. So there's two themes I think I'm interested in exploring. One is cultural sensitivities, and what we talked about. Tea versus coffee versus ice cream, which was a nice sort of way into it. I just wonder whether you, but also the other panelists, might just touch a little bit more on the importance of different sorts of messages for different groups, cultures, faiths, countries. You know, we're talking about Japan, talking about Thomas, you made very interesting points about faith differences, for example, and messaging. I wonder if we might like to just come back in and say if there's some lessons they've had about the importance of difference and how to target in communication. Yeah, why don't you?
So one thing I forgot to talk about in my presentation is that one thing we strive to be is culturally appropriate, but not only in the messages we give, but also in the actions we deliver. So, for example, in our IRS campaigns in Sudan and in Kenya, our IRS teams are female-led, and we have spray equipment that's adapted to be a headscarf and a spray unit, because in these Muslim countries, women often won't let men into the household to help them, because if the man's not there, it's not culturally appropriate. So we adapted, and so we now have female-led spray teams so that females can educate other females and protect other females from malaria in male-dominated societies.
And so you talked about the headscarves and so on, but beyond that, in some of the humanitarian crises and other programs where you've been involved, has, if faith, the mosque, for example, churches and so on, have been often an important focal point, has that also created some challenges in terms of perhaps receptivity to science, often perceived as Western science, and some of the interventions, for example?
To be blunt, in a lot of these male-dominated societies, the men quite often get told by the wives what to do, and so essentially if we can get access to the females, we kind of get access to the males, and so to answer your question in a roundabout way, we kind of twist the question, or we kind of twist the information to kind of deliver it to as many people we can, really. I'm sorry, that's probably not a very good way of answering your question.
But so there's the communication channel, but also in terms of the interventions themselves, use of certain drugs, for example, and so on, or indeed vaccines. Have there been any kind of messages that have come out of navigating different faiths, resistance perhaps to certain messages?
I haven't been with the organisation long enough to answer that, I'm afraid. All I can speak about is my own personal instrument, so I can't really comment, I'm afraid.
So if anybody else would like to come back on those issues, any thoughts?
Sure, certainly. So we recognize how important it is to develop materials and to go into partnerships that are appropriate for the location and are culturally appropriate. We also recognize that in the creation of our public health organization that we would not be able to effectively have the impact that we're looking for from if it's all run out of New Brunswick, New Jersey. So we, over the past couple of years, have opened up 3 centers in sub-Saharan Africa for partnerships, and we've staffed them locally. One in South Africa, one in Kenya, and one in Ghana. And the intent being that if we have local employees who speak the local language and look like the locals, we'll be much more effective in rolling out programs and communications platforms and other initiatives than if we were trying to run them from a distance.
And of course, you've got this big vaccine portfolio. You talked about Ebola, for example. Again, going back to the issues of different cultural perceptions and so on. For example, the anti-vaccine movement, is that something that you've had to address head-on? Has that created some challenges around messaging and communication?
Well, it's certainly something that we do have to address, and something that we have to be aware of and concerned with. We try to base the work that we do in science and the work that we do in fact. And when we relay the facts and the science, we can usually find a receptive ear in governments with funders and also on the ground.
Juan, any other thoughts on this, on the cultural challenges and differences when you've been on some of these big international campaigns you've been involved with to mobilise research?
Yeah, a couple of things. So the researchers we partner with are all over the world, and the volunteers that we recruit and engage are all over the world in the case of World Community Grid. Yet we still see sort of local affinities. So even to give the Zika project as an example, just simply by translating the content into Brazilian Portuguese and not leaving it in English and assuming everyone speaks English, we saw the number of volunteers go through the roof. It became like a local cause that they can rally around. The other cultural thing is sort of a different type of language issue, not necessarily language, English versus Portuguese or so on, but the language that the researchers that we partner with are used to speaking is not necessarily layperson friendly. So there's a lot of work that we put into sort of making the content layperson friendly, and we still leave the technical details because some of our volunteers really love to get into the weeds. But if we just left the content as is, we would have excluded a lot of our volunteers from really learning about these causes and sort of even understanding them, let alone supporting them. So a lot of the challenges we have are in terms of the terminology and bridging that sort of gap between the sort of specific words and technical terminology that the researchers might be used to using on a day-to-day basis versus what is appropriate for our diverse volunteer base.
And Bumpei, just thinking about Japan, obviously quite culturally distinctive, and of course GHIT is global, but nonetheless with this founding core and partnership with Japanese companies, government, academics, and so on. Anything you find as distinctive in the messaging domestically versus internationally?
Yes, so we are always thinking about the difference between Japan and global, but I believe the kind of core message should be universal everywhere. So that's why so we work with the creative agency based in Leipzig, German radio there. So we are beyond the world, beyond the culture, beyond the language. The message should be kind of universal, but based on those difference, which is tailored to each region. That's what.
And Claude, so you started this a little bit with the kind of certain national tastes and so on, and how you channel, but I just wanted to come before I open this up to a different sort of community within global health, as it were, which is, the corporate world specifically. I can maybe to Alan afterwards as well, and then on IBM, but despite what one can say about corporate credos and values and so on, of course there is a huge, commercial impetus as well. So how difficult and different really do those tangible arguments have to be in internal communications, around philanthropy, corporate responsibility, let's say, versus, the fact that if you're making, in JJ's case, 2 million Ebola vaccines, which, ultimately they just get thrown away, for example. If you're working on projects which aren't core to Merck's business, for example, or IBM's, how does that influence the communication internally? How do you really make that case very strongly?
Well, I think Merck is particular because it's a family-owned company, and that's very at the heart of the company. And so for us, making the case was a bit more easy than I would say. It's also a bit more difficult, but what was very clear for us is we had to build more the science around the project rather than the reason why we were doing it, because pediatric praziquantel is the first trial ever run outside of Europe and US for the company, and it was big surprises for people that do the normal job. For example, we had audit team going there and that couldn't understand that the mother was not the mother, or the grandmother. So it's more the internal science communication, scientific education that you need to do. And again, I think if you show that you're serious, you have scientifically driven an argument, and there is a medical need, then you can do the case. Of course, you need to also, it's like everyone else. I mean, we don't work alone, we have partnerships, we have that's a given for going into that field.
Alan, what about for J&J? Obviously, big commitments, big investments, but relatively small returns, whether it's bedaquiline for TB or Ebola vaccine and so on. So how do you push back or make the argument in a different way to get buy-in and resource?
So it's a similar answer. We have a very receptive management. People like Dr. Paul Stoffels, who's our Chief Scientific Officer, who's really a visionary when it comes to public health and spent the early part of his career practicing infectious diseases in sub-Saharan Africa. We developed drugs like bedaquiline for multi-drug-resistant tuberculosis and vaccines like our Ebola vaccine because we have the capability of doing it and it needs to be done. Our global public health organization is not a philanthropy. It is not meant to be. We have a corporate social responsibility organization, and their objective is donation. Ours is to create a self-sustaining business that focuses on access and availability. We do that through partnerships, through funding partnerships, by tapping into incentives where available. For example, the accelerated review voucher from the FDA for the bedaquiline development. So our job is to be innovative in terms of the way that we support this part of our business, the public health part of our business, so that patients benefit on the one hand, but also the company sees us, if not as a profit generator, which I don't think we'll ever be, but certainly as a self-sustaining unit that can support this very, very important work that we're doing.
Mm-hmm. What about IBM in the same way as there is a sustainability model? Obviously IBM has a lot of for-profit health-related activities as well, but do you demarcate projects like this, for example, completely as CSR?
Yeah, I mean, for ethical reasons, we have to keep sort of what we do on philanthropy and what we do on the commercial side separate. But sort of touching on the earlier point that some of my co-panelists made, it's in the culture to really support the work that we do with Citizenship. And I think that's a number of reasons. First of all, we've put metrics behind this. So I mentioned only a couple of our programs, but we have programs where IBMers can go out and volunteer in their local communities and earn grants of services or even small cash grants for the charities and nonprofits that they are volunteering with. So it gives them an incentive to get involved locally and gives them tools and assets to actually use on the ground to, for example, do sessions at schools teaching kids on genetics or just encouraging kids to get into STEM. We also have other programs where we send IBM employees on other engagements similar to the Panama one. And we've put the metrics behind it to show that it helps with employee morale, retention, and just overall develops great leadership skills as well. So it's an easy sell, to be honest. And then, but similarly, it is top, sort of getting buy-in at the top levels of management as well. Our CEO often talks about the work that we do on the philanthropic side. It's sort of, parcel of her message where she talks about education and instilling skills for a cognitive era. She talks about the work that we're doing in STEM education on the philanthropy side as well. And I think the other parts that the two sort of feel natural to each other is everything we do on the philanthropy side is very much, it follows what we do in the business in that we intentionally don't do cash grants typically. Everything that we're doing is donation of skills, expertise, data, technology that the business is very much invested in. We are tying the philanthropic strategy with the business strategy very closely.
I don't know if you want to come in anything at all on corporate angle. Okay, well let's open it up then. Who would like to? Yeah, please do introduce yourself as well. That should be a mic.
Thank you, Juan Zuliani from Richmond University. First of all, thank you for all the panelists for their contributions and for showing us how we can use different methods to communicate and engage with audience, from culturally appropriate flyers and selfies to video campaigns and smartphone apps. I mean, this is a really multi-channeled approach to create awareness and trigger that behavioral change. Now, for your organizations that might use different of these channels, how do you actually measure the impact that different communication methods are having from a truly behavioral change perspective so that you can identify what is better working for different communities that might be influenced by things like superstition, or that might have different technological constraints, which are very common as being the ones that are affected by NTDs. Thank you.
Okay, great question on impact. Who wants to come in?
I'll just say something. I'll just reiterate what we've done from the beginning and what Mentor does in all our programs is that we engage with and we recruit local people as community health educators from day one. So any ingrained beliefs or any ingrained superstitions, we try and represent the communities in everywhere we work with recruiting local people to try and educate their communities. So for us, we try and combat it by bringing people in, showing the evidence, showing things like how malaria is spread, how dengue is spread, and try and go about it that way. I don't think we measure it, as you said, how do we measure the impact? I don't think we do that too well at present. Maybe we can improve on that, but that's how we go about it.
We do measure depending on the channel, but honestly a lot of it is trial and error. So we do a lot of A/B testing. So for example, when we're doing an email campaign, we might try different subject lines, different messaging. We might even target specific volunteer groups and then measure what's the impact, how, click rates, open rates, how many have actually taken the action that we've asked them to take, for example, supporting a Zika project. And that gives us some insight into what messaging is working and what isn't. But it is trial and error because we'll try out different things and tweak and tweak and tweak as we go along.
Anyone else? Two more. Okay, please, in the middle here.
I can probably shout. I'm Katrina from the University of Boston. But I couldn't notice.
Take the mic anyway. Some people can't hear. Thanks.
I couldn't help but notice that the morning talks discussed quite a lot TB, Ebola, Zika, and malaria, and not quite so much neglected tropical diseases. And as Alan puts it, with NTDs, there isn't such a thing as an emergency, it's an ongoing issue. So I would like the speakers to elaborate on whether the challenges and initiatives discussed this morning would be directly applicable to NTDs. And if I'm allowed a second difficult question, the London Declaration was mentioned this morning by one of the 9 speakers. How close, if at all, are we to Margaret Chen's pledge to eliminate 10 of the 17 NTDs by 2020?
Yeah, I mean, for me, I mean, the difference between malaria and NTD is just semantic, is in WHO. I mean, I'm coming from, it's just an historical thing, and I understand why it's there. And I prove it or not, doesn't matter. But so what we've done there, I think, is we did it for Hindo before. So for me, I mean, it's the internal communication is how you build that, but I don't know how you can expand that to others. I mean, what we're facing here is really going to and we actually not only doing quantum donation, we have an R&D arms for schistosomiasis. We do. I mean, I didn't talk about the science because that was not the topic, but we do science. It's not just communication. So we have diagnostic ongoing, etc. And I think for me there is not much difference. It's really going out, doing good science, finding the right partners, securing them, and working with people on the field that are really integrated. That I think there needs to be that's a personal view transfer of responsibility more towards the academic region and for when it comes to research.
Bumpei GHIT is also doing stuff with NTDs.
Yes, so Japan is still emphasizing on the investment in NTDs arena. So that's why the GHIT has been investing around 40% of the investment to NTDs, including schistosomiasis and leishmaniasis, or even mycetoma and the dengue. So Japan is still looking forward to contribute to this arena because there is for the private company perspective, it is very difficult to invest everything into those arenas because that is not so profitable. So because that's why the other third party needs to be responsible for we can do something for to reach a gap between those investment priorities.
Thomas, because you mentioned leishmaniasis, for example, any thoughts again about drawing out the wider lessons to the NTD space?
Well, so we began primarily as a malaria-based organisation, and as our work expanded, we moved into vector-borne diseases, and as my CEO would have loved to have told you, he's now incredibly passionate about neglected tropical diseases. We're looking at onchochoriasis, leishmaniasis. We're now working with partners like Sightsavers to try and launch massive NTD control programs, and increasingly what we're trying to do within our organisation is certainly that if we're in a space or if we're in a place because of a vector-borne disease, now more often a neglected tropical disease as the vector-borne disease or on top of it, we try and make sure that these diseases that, like soil-transmitted helminths, that cause massive debilitating, sometimes deaths, or needlessly, we're trying to bring the medications that are very simple to administer often to these populations, because one of the things that we do very well is we access the most vulnerable populations that are very hard to reach. And so what we're trying to do is bring these but these relatively easily available drugs to the people that can't get access to them. So that's what we're trying to do as mentor anyway.
So at least some momentum towards declaration. Yeah, please, we've got time just for this one more, because we're getting a bit tight. Did I miss anybody else? Perhaps I could, maybe we could just very, very briefly take three and then ask.
I'll be as quick as possible. Hector Diaz-Albater from University of Glasgow and EcoStud in Mexico. And this is for Claude. It's going to be less controversial maybe than the last one. So I think, of course, malaria was a very interesting and a very good choice in the case of developing new resources against it by Merck. I was wondering, going back to the neglected tropical diseases bit, what's Merck's agenda, and if there's other diseases maybe in the near future where Merck will start developing new strategies like maybe leishmaniasis, perhaps.
Let me take you on this briefly at the bottom back there, please. Thank you.
Hi, I'm Catherine at D-Worm 3 at the Natural History Museum. I'm interested in how you balance sort of political messages internally and externally, as it could be seen as like foreign interference in country. With the Commonwealth Heads of Government meeting coming up in April, I was wondering how the NTD efforts might be addressed. I think Johnson & Johnson may have mentioned CHOGM in the calendar coming up.
Okay, thanks. There's one more. Yeah, please.
Thank you. I'm Claudia Cecalupo. I work with the Global Health Institute at Merck with Claude. To be honest, it's a more practical question for Alan, for J&J. I go to an operational question, meaning that I was very impressed from your concept of amplifying the key messages through partnerships. The difficulties I would see in doing that, it's the burden of approval process that you would need to go through for having approved key messages spread also by partnerships. So my question to you is, how do you do to guarantee key messages going out in a spontaneous and in timely manner, considering your approval process internally as a big private sector companies?
I'll do my best. Start early and allocate lots and lots of time. Because we do have responsibilities as a private sector company. There are complicated compliance regulations that we have to work through. We clear all of those messages with healthcare compliance and legal. Cameron can tell you that my slides were going through multiple rounds of approval before I brought them here today. It's complex. But we have certain responsibilities that we have to fulfill. And sometimes the fulfilling of those responsibilities requires a significant amount of additional effort. Sometimes it can be frustrating. But I think that the bar even rises a bit higher when we're working with other partners to make sure that all of those messages are not only only agreed to, but then properly cleared and vetted to make sure that we are staying on the right side of compliance. I think that was your question. Did I answer that?
Obviously, we carry on how you kind of on the broadening the Merck portfolio around.
Broadening the Merck portfolio, I think, is going to be limited by resources. That's obvious. Just the institute, which sounds like a big thing, we're 10, so that's the current size of the group. And I think the initial choice of the two diseases will not matter. So it is an obvious choice to go to Hindo and expand that to diagnostic to also some other aspect. And the idea was really to look across the 3 different businesses, which are very different assets, and to regroup them into specific health solutions. And so the idea there is in neglected disease and skip malaria, and it's really to potentially expand on understanding Hindo, getting a new replacement for praziquantel, because it's the only drug, it's from the 70s. And okay, there is no resistance today, there is debate about that. I don't believe that there is any drug pressure, so I think we're going to see resistance one day. So there needs to be backup there. And the idea is really to expand that and also if we expand disease area, it's going to be with diseases that can be treated around the present water. So that's the idea for the moment. There are some couple of initiatives that goes with E&I and some other with DNDI as well to support some of the project. But it's really case by case. To discovery field.
Maybe just before we finish, then just go into the sort of political messaging, obviously around entities, particularly in the build-up to the Commonwealth Heads of Summit and so on. I don't know, Thomas, do you want to?
Very easy. We are always independent of any political or religious. We're signatories of the Red Cross Declaration, so very easy for us.
But sorry, unless I misinterpreted, I think it's less politicisation, as it were, but more how to raise the political agenda. Would that be right? With policy, with heads of state, with ministers and so on, about investment or commitment to NTDs, for example, with some of these big summits. And obviously you receive donations and so on. Is there much thinking or advice perhaps around that, how to get it on the agenda of the big international meetings?
I'm going to have to sub in for Richard, who's not here, because I'm much more on the programme side of things, and I'm not high enough. I don't have the, it's above my pay grade, so to speak, with the political.
Okay. Anyone else want to try that?
So the reason why we refrained last year because Japan hosted G7 summit in 2016. That was the moment that the government of Japan or any other G7 government needs to recognize that again we need to have those infectious disease. So Japan will host the training summit next year. That's we utilize those international conference to increase awareness of all around the world, and specifically the G7 government training.
Yeah, I was just going to say that, in the Panama example, we're working directly with public health organizations and officials, so the lines of communications are already there. It's it's the buy-in is already there. With the researchers, for example, that we work with on World Community Grid, that actually becomes a very important part of our communications campaign. So I mentioned, reaching out to potential volunteers and the press and media and so on. But we actually also sort of tap into, so we have corporate citizenship representation throughout the world, and we tap into our local representation in the relevant country to tap us into, and they work with their connections, for example, with government relations and so on to essentially identify who are the influencers in the space, who are the policymakers, who are the decision makers, and how can we raise awareness of the work that we're doing to those relevant groups. So it's honestly more of a relationship, sort of tapping into existing relationships and tapping into local people who might have the relevant connections to the policymakers and the decision makers.
just about slightly over time, so I'd like to thank all our panelists and hand back to Cameron.